Hey everyone, it's Connor here from Durham Hearing Specialists. I hope you're doing well, and welcome back to a very interesting case. We have here a diabetic patient, or technically pre-diabetic or borderline, and you're going to see a few complications in this earwax removal. Notably, two areas of the ear now where the skin is deteriorating and then there's bone, exposed bone. And I thought this would be a nice case to upload because of late we've had a lot of questions come through about diabetes. And I've mentioned diabetes many times in previous videos as a risk factor and as a possible explanation for what we're seeing, particularly sort of the gnarly infection videos, things like that. But I've never really explained why, I just kind of mentioned it in passing. So I thought I would explain it in this video because I think it's relevant. So, what is diabetes and why do we care? Why do we ask about it? And it is on our consent form. Before we do microsuction, we look at the standard checklist. Are you in pain? Do you have vertigo, etc., etc.? We do ask whether they have diabetes. If they say yes, we ask which type is under control and so on. So there's a little bit of bone just there, but I'll probe that later on. So there's a little bit of bone down here as well, which I'll just uncover. Right here, lift that up. There we go. So I'll expose it a little bit more. So diabetes is systemic. It's a chronic condition, other than gestational diabetes, but that's sort of out of the scope of this video. So type 1 and type 2 diabetes are chronic. And it's characterised by having high blood sugar levels, high levels of glucose circulating around your blood. So, if you think about, if you eat a spoonful of sugar, or lots of pasta, or rice, and so on and so forth, bread, they are basically all broken down by your body into the same thing, which is glucose. It's just that bread and pasta, for example, are complex carbs, so they take longer for your body to break down into glucose rather than spoons of sugar. And if you eat lots of this stuff, that will eventually result in a high level of glucose, blood sugar level, going around your body, and then as a result of that, the healthy the pancreas will produce insulin. Okay? And insulin is a sort of chemical instruction to the cells of your body to take in sugar. So if the pancreas releases insulin, then your blood sugar levels should go down as the cells take in your blood. Now in type 1 diabetics, the pancreas doesn't produce enough insulin. The beta cells in the pancreas don't produce enough. There's a shortfall, they don't produce it at all. And that's the kind of diabetic patient that you might be injecting insulin on a daily basis, which is perhaps a little easier to manage per se than type 2. Type 2, which is more common, is where it doesn't matter if the pancreas produces enough insulin or not, the cells of your body don't respond to insulin. So in other words, there's a level of insulin resistance there. And that can be managed by diet or metformin and so on and so forth, but it is, I would say, more common, particularly in elderly patients. We've got a live audio here. Yes, no granulation, which is a good sign that they are getting there. It's unmistakable. When you touch bone, this means quite a large area. When you touch bone, it looks like dead skin actually, but the feeling you get in your wrist is very much like a brick. So diabetes under control.
She's only been type 2 when we last saw you.
Yeah.
She'd only just been into the threshold, so she's the last one which we had seen wasn't very high, so she's on no treatment for it. She's on yes, diet control, but I don't think it's only very strict with it,
Right. We might have to do something. This might be a sign that things are a little bit more. I thought I'd just give you a little bit of live audio because I think it's interesting, and you could hear me talking to the daughter there about the diabetes. The daughter mentioned something interesting. She mentioned an HbA1c test, which is a blood test that doctors use to check for diabetes. So, and what they're testing for is how much hemoglobin is glycated. So, and this is one of the reasons why having diabetes uncontrolled is such a problem, because these molecules of glucose that circulate around your body, they will eventually stick to things. So they glycate things. They they stick to proteins, and that's what they're looking for. How much of your hemoglobin in your blood has glucose stuck to it? And the thing that we really care about when we ask about diabetes is if it's uncontrolled, that tends to cause microvascular disease or microvascular angiopathy. So angios is Greek for vessel, and pathio is related to pathos, which is Greek for suffering. So small blood vessel problem. And what you get is these glucose molecules, which are always there and often spill over into your urine, so you have sweet urine if you have uncontrolled diabetes, it's damaging all blood vessels in the body, but particularly the very, very fine small capillaries that perfuse tissues. So the very, very fine blood vessels that give oxygen and nutrients to the tissues of your body, and then obviously the tissues give back carbon dioxide and waste products, things like that. And if you have molecules of glucose sticking to proteins all over the body, that causes dysfunction in the lining of your capillaries, or the vascular endothelial cells that line all the blood vessels of your body. And then you have problems whereby this inner lining of your blood vessels becomes dysfunctional, and you get plaques building all over the place, and these blood vessels actually start to die off. So you have poor perfusion of tissues, and that's why diabetic patients sometimes, unfortunately, you see them losing feeling in their fingers, peripheral neuropathy, and they might have a toe or a foot amputated, things like that. That's why I'd be worried about retinopathy, so on and so forth. So, having high levels of glucose circulating around your body will eventually lead to a lot of serious complications. And I rather suspect that that's what's happened here, because obviously you have this area of erosion on the floor of the ear canal. There is another area just to the right-hand side, which I've not picked up on yet, but I will do in a moment, and I'll share some more live audio with you. So I also note that as I'm kind of debriding all this dead skin away, it's not hurting the patient, and it should be, really. She should be able to feel this, and she isn't. So yeah, we see microvessel disease, microvascular disease. And I rather suspect it's not just the glycation of glucose sticking to things. Having high levels of glucose also increase the level of free radicals in your blood, or what some people call ROS, or reactive oxygen species. So this special lining that I'm talking about, your vascular endothelial lining, those cells produce something called nitric oxide, and nitric oxide is very important for the regulation and health of that lining, but also it helps your blood vessels expand when they need to. Okay, so if you have lots of nitric oxide being produced and it's just getting glycated all the time, then that produces free radicals. If you're not sure what a free radical is, it's basically a molecule that is highly reactive and damages cells in your body. And in fact, that's why whenever you go to the supermarket, you see healthy orange juices and grape juices high in antioxidants. That's what the antioxidants are trying to do, combat those free radicals that are zooming around your body. In actual fact, drinking a litre of orange juice each day is not healthy. If you're diabetic, you definitely shouldn't be doing that. But that's just another reason why having uncontrolled diabetes is actually a very, very, very serious problem. And if someone comes into your clinic and says, I have diabetes, but I don't really care about it, and so on and so forth, you probably should tell them. You don't have to be an expert in diabetes or a diabetic nurse or a doctor. You just have to say, you should probably have a conversation. Go back to your doctor and have a conversation about it and figure out a plan, because it's not something that can be ignored. I'll just share another bit of live audio with you. That appears to be the only area. and perhaps been caused by the diabetes, because it's not just a little area on the floor of the ear canal, which I suppose could be explained away by trauma. But the fact that there's multiple sites, and possibly a few more that I've missed, the fact there's multiple sites kind of gives credence to the fact that actually something needs to be done. Something needs to be done. And I have pinged this patient through to ENT quite urgently, and the ENT, as per usual, will debride everything again and instill some ointment. That's been done very, very quickly. I don't know if those areas will be epithelialized, basically the skin growing over. I somewhat doubt it. But at the very least, it's cleanish. It's not an amazing job, but I was less interested in doing the drug